Welcome to this episode of Case Bites, brought to you by Henry Schein. I'm Dr. Michael DeFee, and today we're going to talk about 3D printed occlusal guards. So for those of you who don't know me, I'm the co-founder of the Mod Institute with Dr. Wally Renee in Charleston, South Carolina, where we are super passionate about 3D printing and the ways that it can change in how you practice dentistry. And so this is our facility where not only are we doing education, but we're seeing patients on a day-to-day basis where we're putting into practice all the workflows that we're teaching, and we're staying on the cutting edge of what is coming in dentistry. And so many of you probably have heard about 3D printing. Maybe you're doing 3D printing. Maybe you're nervous about 3D printing. But I want to tell you, there's not a part of my practice that hasn't been touched and improved by incorporating 3D printing into my workflows. From veneers, inlays, onlays, crowns, implant crowns, dentures, partial dentures, surgical guides, all-on-X prosthetics. There are so many efficiencies incorporating 3D printing within your practice. But today what we're going to talk about is occlusal guards. One of my favorite things to 3D print, because not only can it be super efficient, but for large cases where I know I want to have a patient in an occlusal guard, I can deliver that the same day that I actually deliver the case. It's amazing. It saves the patient a visit. And the ROI for doing these types of procedures is just really, really good from an economic standpoint as well. And so the most common type of occlusal guard that we're doing in our practice is a Michigan style anterior guidance, posterior disclusion. This is very, very easy to deliver predictably from a 3D printing workflow, especially if you're doing design in your practice. But even if you're not and you're using a designer or using an AI service, you can get occlusal guards that will fit whatever workflow you're using, and they'll be super predictable and super easy to use. One of the things I want to, spend a little bit of time talking through is the literature and just justifying how we're using these types of appliances, where we're not only using them for wear, but we're using them for managing TMD signs and symptoms. And so this is a study, a systematic review of meta-analyses that was published in the Journal of American Dental Association, where they looked at 11 randomized controlled trials to see, is there a benefit for using splint therapy in patients who have TMD signs and symptoms? Overwhelmingly, what this study showed was yes. And so the trend for a lot of managing TMD signs and symptoms is trending towards doing it much more conservatively. And so that a lot of times includes splint therapy as part of the treatment, which is another reason to be able to incorporate this in your practice and help your patients who are in pain to get out of pain and get in a place where they can enjoy life and get other dentistry that maybe they need to have done. And so, one thing to talk about a little bit with 3D printed occlusal guards is the way we manufacture them and the way we nest them is what the 3D printing term is, affects a lot of things about the guards, not only their wear resistance, but also the other mechanical properties as far as fracture toughness, and also the accuracy and the fit. And so what you see on your screen is three different guards printed at different angles. The one on the left printed at 0 degrees or flat. The one in the middle at about 45 to 50 degree build angle. And the one on the right at about a 90 degree build angle. And so what this study showed that I have cited on the bottom of the slide is when you print at a 45 degree or at a 0 degree build angle, the wear resistance for 3D printed occlusal guards is as good as a traditionally fabricated heat cured acrylic appliance. We also find that printing flat is the most accurate way to manufacture these appliances. And so for me, not only does that help with the accuracy, but it helps with the speed. And since I'm often doing these types of appliances, designing, printing, and delivering same day, I'm always manufacturing at a 0 degree build angle. We'll talk a little bit about how I'm, designing that in the nesting software to not affect the occlusion that I've designed in the splint itself. And so the beauty of 3D printed occlusal guards is any of the FDA validated workflow for printers has an occlusal guard workflow, whether that's Prime Print, whether it's a Desktop Health, Accurata Soul, Sprint Ray type printer, a Asiga. They all have occlusal guard resins that you can print in an FDA validated workflow in your office. We're going to focus a little bit on the Sprint Ray Pro 55S because this is the printer that I'm using most often when I'm printing occlusal guards. And so let's jump in and look at our case. So this is a patient, day of delivery for an upper and lower all-on-X hybrid prosthetic, full zirconia, direct to multi-unit. We know we want to protect this prosthetic for this patient. And so for me, it's almost always includes sending a patient home with an occlusal guard to wear at night to manage any type of nighttime parafunction that they may have. This patient had a history of extreme wear with her teeth, so I know she has some parafunction going on. And I want to protect this prosthetic, from the time investment on myself, but also from the patient and the financial investment to make sure it's going to last a really long time for her. The other thing with this patient, as you can see, as she opens deviated over to that left side, is she's got some TMJ issues, some pathology going on that we also want to manage and help ensure that she's not going to get any type of aggravated symptoms after the delivery of this zirconia prosthetic. And so really important when you're taking the records for these type of guards is, first you need a high quality scan, which I think all of us kind of know what that includes. We like the 5 overlapping passes workflow to ensure that we're giving the software a scan data in a way that's going to result in a very accurate 3D model. But you also need to take your bite record at an open bite with about 2 to 2.5 millimeters of clearance in the posterior, so you have space for your occlusal guard to be designed. You don't really want to be opening and closing a pin on a digital articulator because you're just introducing areas for inaccuracies to be a part of your workflow. And so for this patient, I'm using our mod jig, which is a 3D printed jig you can get off our website and print. It bonds composite really, really tenaciously. So as you can see, I have her index at the centric relation bite that I want the splint to be designed at. Design the splint in exocad and then straight into the Pro 55S, the Rayware Cloud Slicer. It comes in at 45 degrees. I'm reorienting that flat 0 degrees. I leave little indentations where my occlusal marks are so that I can place my support tips around that and not affect the occlusion when I'm removing the supports. And then here we are with the print. It's about 28 minutes to print, so after the delivery of the prosthetic, the patient's, reading a magazine, drinking a little bit of water. We're printing this, getting it processed. The wash and cure is about 10 minutes max to spray wash and then cure in the Procure 2. There's our guard, beautifully designed, beautifully printed, going to be super accurate. Here we have it delivered. The occlusion is exactly how I designed it. Coincident contacts throughout the arch with the exact guided scheme that I wanted. And you can see the fit, beautiful adaptation around that upper prosthetic. The fit is just really, really amazing. And so the ROI, if you're doing these types of appointments same day, you want to, take your records, design, print, and deliver all in the same appointment. It's really doable in about 45 minutes if you're doing the design in-house, which we do. Doctor time should really only be about 5 minutes. I'm not doing the scans. I'm doing the bite scan and taking the bite record to make sure it's exactly accurately how I want it. Doing my design, printing it, and then my assistants are doing the washing and curing, and I'm delivering and confirming the occlusion. The cost to print this appliance that we just looked at was about $2.50. It's about $400 to, maybe down to $300, up to $500 or $600 in your practice, just depending on where you are. But a huge ROI for that type of appointment, where we are able to make these accessible for all of our patients. If you want to learn more about these workflows and potentially how to design your own guards, I teach those as part of our occlusion track, the Mod Institute. You can check it out on our website. Thanks again for tuning in to this episode of Case Bites brought to you by Henry Schein. I'm Dr. Michael DeFee. Please, I love to see your cases. If you have questions, I'm just super excited about you bringing the excitement towards 3D printing that we have in our office into your practice so that you can see how it's going to improve not only the efficiency, but also the patient outcomes in your practice. Thank you.